Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. HPV, Warts. Introduction. HPV stands for human-papillomaviruses. They are common viruses that can cause warts. There are more than 100 types of HPV. Most are harmless, but some put you at risk for cancer. The types of HPV that raise your risk for cancer are spread through sexual contact with an infected partner. Correct usage of latex condoms greatly reduces the risk of catching or spreading HPV. Vaccines can protect against several types of HPV, including some that cause cancer. This program explains HPV. It talks about the symptoms, causes, diagnosis, and treatment of these viruses. It also covers how to prevent getting or spreading HPV. Symptoms. Some people who are infected with HPV may not have any symptoms. This is because not all types of HPV cause health problems. Some types of HPV cause warts to grow on the body. Where the warts grow depends on the type of HPV. Different types of HPV cause warts on different parts of the body. HPV may cause warts to grow on the elbows or knees, face or neck, feet, genitals, hands. Warts that grow on the hands are usually common warts. Common warts are rough bumps that are raised. They do not usually cause any problems. Plantar warts grow on the feet. These warts are hard growths. They often grow on the heel or ball of the feet. Plantar warts may cause pain. Flat warts may grow on the face or neck. They may also grow on the hands, elbows, or knees. These warts are darker than your normal skin color. They are slightly raised but flat on top. HPV infections that cause flat warts are more common in children or teens and are not sexually transmitted. There are more than 40 types of HPV that cause genital warts. Some of these types may cause cancer. In women, genital warts can grow outside and inside the vagina. They can also grow on the cervix or around the anus. In men, genital warts are less common. If present, they usually grow on the tip of the penis. They may also be found on the shaft of the penis, on the scrotum, or around the anus. Genital warts can also spread to the mouth or throat through oral sex, but this is rare. You should talk to your healthcare provider if the warts bother you. You have warts that are painful or bleed. Your sexual partner develops genital warts even if you do not have symptoms. Causes. HPV infections are caused by certain viruses. These viruses are known as human-papillomaviruses. The virus can enter the body through a cut or wound on the skin. It most commonly spreads through skin-to-skin contact with an infected person. HPV infections that cause genital warts are spread through sexual contact with an infected person. The genital warts can spread very easily, but a person does not need to have symptoms to be able to spread the infection to others. A genital HPV infection can spread through oral sex as well. This can cause warts to grow in the mouth or throat. Rarely, a mother can give the HPV virus to her baby during delivery. An HPV infection can affect the baby's genitals, mouth, or throat. This can be life-threatening for the baby. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. First, your healthcare provider will ask about your symptoms and medical history. He or she will also perform a physical exam. If warts are present, your healthcare provider may be able to make a diagnosis after looking at the warts. Some types of HPV infections will go away on their own and not cause any health problems. Other types of HPV infections may need further testing. These usually include HPV infections that cause genital warts. If your healthcare provider thinks you have genital HPV, he or she may use a vinegar solution test. For this test, a vinegar solution is applied to the genital area. Areas that are infected will turn white. It can help reveal flat warts that are harder to see. For women, a Pap test may also be done. During a Pap test, a sample of cells is scraped from the cervix or vagina. The sample is then checked in the lab for cancer or changes that may lead to cancer. Your healthcare provider may also use a DNA test. This test uses a sample of cells from the cervix. The sample is tested for DNA to see which virus is causing the infection. Some types of genital HPV can lead to cancer. Treatment. Warts caused by HPV usually go away without treatment, but even after the warts have disappeared, you can still spread the virus to others. If you have warts that bother you or are painful, treatments are available. Treatment for warts caused by HPV may include medicine, surgery, or other medical procedures. There are many medicines that can be used to treat warts. These are usually applied directly to the wart. In some cases, it may take more than one application for the wart to go away. Medicines are available over the counter or with a prescription. Salicylic acid is one over-the-counter medicine that may be used. It requires many applications. Only a little bit of the wart is removed each time. This medicine should never be used on genital warts. It can cause severe irritation. Prescription creams are also available. These creams may help your immune system fight HPV. They may also destroy warts. Trichloroacetic acid may be used. It is a chemical treatment. The goal of this treatment is to burn off genital warts. If medicines do not work, the warts may be physically removed. This may be done by freezing the warts off, which is called cryotherapy, surgical removal of the warts, using an electrical current to burn off warts, which is called electrocautery, using lasers to remove the warts. A home remedy involves covering the warts with duct tape for 2 months. This approach has worked for some people, but its effectiveness has not been proven. Although treatments can get rid of the warts, none can get rid of the virus. Because the virus is still present in your body, warts often come back after treatment. Prevention. You can take some easy steps to help prevent HPV infections. This section talks about the ways in which you can prevent HPV. It is difficult to prevent common warts caused by HPV. These types of warts usually do not cause health problems, but they can spread easily. Make sure you do not pick at the warts. Also, do not bite your fingernails. You can reduce your risk for plantar warts by cleaning your feet regularly, keeping your feet dry, wearing clean socks, wearing shoes in pools and locker rooms. It is very important to try to prevent genital HPV infections. Some types can lead to certain cancers, including anal cancer, cancer of the penis, which is rare, cervical cancer, oral cancer, vaginal cancer, vulvar cancer. To reduce your risk of genital HPV, you can abstain from sex or be in a mutually monogamous sexual relationship where both partners are not already infected with the virus. Keep your number of sexual partners to a minimum. Use a latex condom properly. Correct usage of latex condoms greatly reduces the risk of catching or spreading HPV, but it does not eliminate the risk. Vaccines can protect against several types of HPV, including some that can cause cancer. Vaccination lowers the risk of cervical, vaginal, vulvar, anal, and oral cancer. HPV vaccination is most effective when given to children before they are sexually active. Vaccination is available for males and females ages 9 through 45. HPV vaccination of older adults provides less benefit because more people in this age range were exposed to HPV already. HPV vaccines work. They have dropped HPV infections that cause cancers and genital warts by more than 80% in teen girls and young adult women. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. HPV stands for human-papillomaviruses. They are common viruses that can cause warts. There are more than 100 types of HPV. Most are harmless, but some put you at risk for cancer, including anal cancer, cancer of the penis, which is rare, cervical cancer, oral cancer, vaginal cancer, vulvar cancer. The types of HPV that raise the risk for cancer are spread through sexual contact with an infected partner. To reduce your risk of genital HPV, you can abstain from sex or be in a mutually monogamous sexual relationship where both partners are not already infected with the virus. Keep your number of sexual partners to a minimum. Use a latex condom properly. Although some people develop genital warts from HPV infection, others have no symptoms. Warts caused by HPV usually go away without treatment, but even after the warts have disappeared, you can still spread the virus to others. If you have warts that bother you or are painful, treatments are available. Treatments for warts caused by HPV may include medicine, surgery, or other medical procedures. Vaccines can protect against several types of HPV, including some that cause cancer. In women, Pap smears can detect changes in the cervix that might lead to cancer. Thank you for using Explain.